doctor.
Hi, folks. My name is Dr. Frank Bonura. I'm a gynecologist. I'm director of menopausal health and director of the osteoporosis program here at St. Catherine of Siena. And this is one of several of these programs that we've done from St. Catherine's for both men and women on various medical issues. Next slide. Our topic today, nope, you win. Our topic today is on people who are overweight or obese. Next slide. Here's a happy couple. They look like they're overweight or obese. Next slide. Now, how can we tell if we're overweight or obese? We measure our body mass index. All you have to do is Google body mass index, and it's your weight in kilograms divided by your height in meters square. So if you put in your weight, you put in your height, click a button, you get a number. If your BMI is 25 to 29.9, you're overweight. And if your BMI is 30 or more, you're obese. Next slide. Obesity in America and in the world is an epidemic. I guess you could even say it's a pandemic. 71% of our populace are overweight or obese, and it's one of the leading causes of preventable death. If you're overweight or obese, you can shorten your lifespan by 5 to 20 years because these conditions cause cardiovascular disease, high blood pressure, heart disease, stroke. They cause type 2 diabetes and can cause cancer. Next slide. Now, what are the causes of being overweight or obese? Number one, and there's not a negative energy balance. We're taking in more food than we're losing energy with physical activity. The reason why we have an increase in food intake in America is we have an increase in food supplies. We're eating foods that are high in calories, and we're eating larger portions. The decreased physical activity in America is due to the fact in the early 1900s, our jobs were more physical. Our jobs now are sedentary jobs. You're sitting a lot. You're sitting in front of a computer. You're doing video games. You're watching a television a long period of time. And lastly, you're living longer. So you have more of a chance of gaining weight and becoming obese. The genetic causes of obesity we see mostly in children who have severe obesity. Next slide. The, I'm going to interchange two words. Instead of saying adipose cells, I'm going to say fat cells. Now, fat cells in our body make a hormone called leptin. It's the major hormone that controls our appetite. The leptin hormone gets into our bloodstream. It goes to our brain. We have leptin receptors. And when it stimulates the leptin receptors, we get the sense that we're full and we stop eating. Next slide. People who are overweight or obese make a lot of leptin. Their receptors in their brain desensitize, so they continue eating. They never feel full. Next slide. It's so important that people measure their waist size, and I'm going to explain to you why. Next slide. Look at this young lady who's obese. Look from the right side of her abdomen to the left side. First, you see a blue line, that's her skin. And underneath her skin, it says subcutaneous fat. That's when you feel that when you say pinch an inch. Then the pink line is your abdominal muscle, but the serious fat is visceral fat. We're going to talk about that next. That's so serious, visceral fat. Next slide. It's so important that you measure your weight size. If you ladies out there have a waist size of 35 inches or more, or you men out there who have a waist size of 40 inches or more, you have central obesity, meaning you have visceral fat that is around all your organs inside your abdominal cavity. Now, the problem with visceral fat is that it's metabolically active. One, it secretes inflammatory substances, so you're in a low grade systemic infection. And that's why people who get the COVID virus, their morbidity and mortality is higher. They already have a low grade systemic infection added to the infection from the COVID virus. Secondly, these fat cells are filled up with triglycerides. And when the fat cells break down, they release free fatty acids, which cause damage to your blood vessels. And lastly, fat cells contain an enzyme called aromatase, which converts male hormone to female hormone, and that can cause cancer. Next slide. Now, what happens to a person who's overweight or obese? This chronic inflammation causes an increase in insulin resistance, which means for you to be able to use food in your cells, the pancreas makes insulin to push the food into your cells. This chronic inflammation causes an insulin resistance, and over a period of time, your pancreas burns out and you develop type 2 diabetes. When you have fatty tissue around your kidneys, and when these fat cells release lipids, you develop high blood pressure, you develop myocardial infarctions, you can develop stroke. If you have fat tissue around your throat and in your abdominal cavity, what happens is your diaphragm is pushed up. If you have it around your throat, when you lie down to sleep, you don't respirate properly. Your lungs don't open and close the way they're supposed to, and you develop sleep apnea. With all this weight that you're carrying, you're loading your joints, you develop osteoarthritis. If you have a lot of fat inside your abdominal cavity, you develop GERD. If the fat cells release these lipids, I said, you get cardiovascular disease. You also get cancer because of the enzymes that it releases. And you also have a low vitamin D level because vitamin D is stored in your fat cells. And the more fat cells you have, the less vitamin D you have to circulate throughout your body. Next slide. These are if these are the cancers that women who are overweight and men who are overweight can develop. Some of them: thyroid, kidney, pancreas, colorectal cancer, gallbladder, and in women, cancer of the breast, cancer of the endometrium, ovarian cancer, and in men, prostate cancer. Next slide. The slide just shows increase in breast, endometrial, colorectal, and ovarian cancer in women due to the fact you're making aromatase. In men, prostate cancer. And what happens, aromatase transforms the male hormone that we make and what ladies make, transforms it to estrogen and causes these cancers. Also, the chronic inflammatory state from being overweight and obese affects the DNA in some of your cells. It mutates the cells, they proliferate and form cancer. Next slide. Oh, this is a young lady who's in the reproductive stage of her life, meaning in the state where she could become pregnant. Next slide. The problem in young women who are overweight or obese is they're making high levels of estrogen and high levels of insulin. So they have menstrual abnormalities. They don't ovulate regularly. They develop infertility and their pregnancy rates are very low. Next slide. Now, many young people in the reproductive stage of their life go for IVF, but the problem is if you're obese and go for IVF, your egg cells that you make are smaller. They don't fertilize quickly. When you make an embryo, they're not in a good quality embryo. There's impaired implantation of that embryo in your uterus, so you have a lower success rate. Next slide. If a person who's overweight, and especially those women who are obese, become pregnant, there's an increase in miscarriages. There's an increase in toxemia or preeclampsia. There's an increase in premature delivery. There's an increase in gestational diabetes. There's an increase of very large babies. There's an increase in cesarean sections. And there can be some birth defects that are associated with being obese and being pregnant. Next slide. Let's talk about my practice. I said I'm director of menopausal health, and my practice on many of my patients are menopausal. Next slide. You ladies who are menopausal who are obese run a very high risk of developing type 2 diabetes. You have a high risk of developing hypertension, heart disease, stroke. You have a high degree of developing vitamin D deficiency. Many of you have an increase in hot flashes because fat acts like an insulator and you can't dissipate the heat. But mainly what I worry about in my patients who are overweight or obese, because of their high estrogen levels, we worry that they develop breast cancer and endometrial cancer, and probably more than 50% of patients who develop breast and endometrial cancer are overweight or obese. They can also develop ovarian cancer and colorectal cancer. So we were very concerned when we see you in our practice when you're overweight and obese. Next slide. Now, what is the therapy for obesity? Well, the therapy can be diet and exercise, and you will lose 5 to 10% of your total body weight. There's medication that you can use, and there's surgery, bariatric surgery. With bariatric surgery, you can lose up to 25% of your body weight. Next slide. Now, when we eat food, we extract from the food glucose. That glucose goes into our cells, and what makes it go into our cells for energy is insulin. When we fast, when we don't eat, what happens is the fat cells break down in our body. They release fat lipids that go into the liver. These free fatty acids go into the liver, form ketone bodies, and they are used for energy for our cells. Now, there are two types of intermittent fasting diets. The one is eat 500 to 700 calories 1 to 2 days a week. Next slide. Another diet is intermittent fasting diet is eat between the hours of 10 a.m. to 6 p.m. any quantity of food, but the remaining hours, water, no sugar, no calories. The only problem with the intermittent fasting diets is many patients complain of hunger and become very irritable. Next slide. The diet we eat at my house, the diet we recommend, the diet the American Heart Association recommends is the Mediterranean diet. The Mediterranean diet is daily. Eat fruits, vegetables, whole grains, legumes and beans, nuts, lean animal protein, fish, and low fat dairy. This is an excellent diet to be on. You will not feel hunger. You will not be irritable when you eat this diet. And you can Google it, it's on your computers. It's very simple to follow. Also, you can join a weight loss program. We recommend Weight Watchers. We recommend Jenny Craig. Next slide. What about exercise? Well, let me just tell you a few facts before we talk about exercise. If you're a man or a woman watching and you're 50 and older and you don't exercise, you lose lean muscle mass, which means you can lose almost 1 pound of your muscles per year. What your muscles are needed for is muscles burn calories. If you don't exercise, especially resistance training with weights or with bands, you lose muscle fibers, your muscles become weaker, you lose strength, and then you're too tired, you're too weak to exercise. When you exercise, and we recommend you adults 150 minutes of moderate exercise a week with an activity tracker. I say that's not enough. I say you should walk 1 hour brisk walking 7 days a week and use either light weights or use resistance bands 20 minutes 3 times a week, but never on consecutive days. And if to tell your kids or grandkids they should exercise an hour every day, you should limit them, and their parents should limit their TV games and watching TV and video games. And next slide. Here's ladies on a treadmill. Next slide. Here's ladies doing resistance training. When you contract your muscles, you're releasing a protein from the muscles called myokine. What that myokine does, it reduces insulin resistance and helps you preventing type 2 diabetes, and it can kill some cancer cells, especially colorectal cancer cells and breast cancer cells. Now, all these things that I discussed, diet and exercise, all they do, they can reduce your risk of cardiovascular disease, type 2 diabetes, and cancers. Next slide. Here's me on a spin bike. I like to spin. This is my vigorous exercise. Next slide. Now, what about weight loss medications? Well, these are the weight loss medications: Victoza, Xenical, Osmia. You can lose 5 to 10% of your weight, but it's pretty expensive. And these are, you should consider weight loss medications if your BMI is 30 or more, or your BMI is 27 to 30 and you have coexisting conditions like sleep apnea, your lipids are high, you have cardiovascular disease or type 2 diabetes. Next slide. Weight loss surgery. Here at St. Catherine of Siena, we have a weight loss or bariatric program, which consists of, if your BMI is 40 or more, or your BMI is 35 to 39, and you have type 2 diabetes, cardiovascular disease, sleep apnea, it's a program where you register for the program, you're seen by an internist who screens you for type 2 diabetes, cardiovascular disease. You're seen by a psychologist. You're seen by a nutritionist, and then you're seen by an exercise physiologist. And then, if you're eligible, you're seen by one of our bariatric surgeons. Excuse me. The operation that's done today most frequently is the vertical sleeve gastrectomy. And the reason for it is The OR time, the operating time is lower, and the major complications are lower than the gastric bypass that was done years ago. Next slide. This slide shows a normal stomach before and after the vertical sleeve. 70 to 80% of your stomachs are removed. Now, the problem if you have this surgery done is, next slide, is that you may develop a calcium or vitamin D deficiency, which can cause bone loss, and that can lead to osteoporosis. So we recommend that you get a baseline bone density, or DEXA, and then repeat it 1 to 2 years after surgery, and make sure after your surgery that you're taking calcium supplements and a higher dose than normal of vitamin D, and have your physicians monitor your calcium and vitamin D levels. Takeaway point, excuse me. You need to eat a healthy diet. The best diet, I think, is the Mediterranean diet. Secondly, you must exercise 7 days a week if you want to be healthy. If you're overweight or obese, you should seek help. And that's all I have to say. If anyone has any questions, Teresa will speak and tell you where to send your questions to. If anyone has any suggestions for future topics, please let us know. Thank you, and please enjoy your lunch.
Dr. Bonura, we did have one question that was emailed prior to the presentation. One of your guests asked, how can weight gain be avoided, managed, and or controlled when it is a side effect from taking a certain drug, Arimidex? Dr. Bonura?
Yep.
One of your patients or one of your guests asked this question: how can weight gain be avoided, managed, or controlled when it is a side effect from taking a certain drug, Arimidex?
I'm sorry, I didn't understand the question. You have to come closer. Or...
How can weight gain be managed or avoided the side effect of taking Arimidex?
I deal with patients who are on Arimidex. For those of you who don't know what that is, Arimidex is an aromatase inhibitor. What Arimidex does, it stops the production all over your body. It blocks that enzyme aromatase, so you have no estrogen. And women who are on it develop severe vasomotor symptoms, hot flashes, night sweats, insomnia, vaginal dryness, pain with intercourse. But how you could prevent weight gain is exercise 7 days a week. Watch what you're eating. Eat smaller portions. Follow the Mediterranean diet. Any other questions?
We're checking now if anyone has any questions.
What about vitamin D? The latest report said that vitamin D was not useful in menopausal women. Can you guys hear me?
I can hear you. I don't think Dr. Bonura can hear, but I'll repeat the question to him. Let me repeat that. So she asked that there's a report that vitamin D is not useful in menopausal women.
Yeah, what the report you're talking about is the VITAL study. The problem with the VITAL study is they took a whole group of women, they put them on vitamin D, and they put them on omega-3 supplements, and they were looking to see if it had any effect on cardiovascular disease or cancers, but most of the people had normal vitamin D levels in that study. So it wasn't really a very good study. I'm director of the osteoporosis program. We do know from randomized controlled trials that vitamin D helps your bones. So you should be taking vitamin D not to prevent cancer. You should be taking vitamin D for your bones. And as I said, that study was not a very good study in the sense that many of the women in the study already had normal vitamin D levels.
Okay, I see Phyllis, you have a question?
Hi, yeah, can you hear me?
I can hear you. I'll repeat your question to Dr. Bonura.
Okay, thank you. First of all, hi. And secondly, we're Italian and we're in such terrible habit of having pasta on Sundays and everything has cheese on it. I know Dr. Bonura recommends the Mediterranean diet, but how do you wean yourself off of all the good things that we love and taste so good and get your mind wrapped around this new way of thinking? I just so
I
hard.
love that question, Phyllis, and I can relate. So let me pass that on to him.
So Phyllis says we're Italian and we have a habit of pasta on Sunday and a lot of cheese. So how do we wean ourselves off of these delicious foods that we love and adapt to the Mediterranean diet?
First of all, pasta is not weight gaining. It depends how much you eat. In our house, we eat a quarter of a pound of pasta with vegetables, 2 people for 2 evenings. It's mostly vegetables. You can have pasta every Sunday, but it depends on the portion of pasta that you're eating. You should be eating a whole wheat or a vegetable pasta. Cheese you can put, cheese is good for us, but you should not smother your pasta with cheese like I do. Is there any other part to that question? And you,
Phyllis, did that answer your question?
It did. I'm a patient of Dr. Bonura's and for many years, and for 51 years, I was a size 5, so I was very spoiled. Suddenly, all of that has changed, and I'm listening to his lecture and understanding that it's the metabolism that changes. So is there anything short of the medications that can grab hold of that?
So Phyllis says she's a patient of yours and for 51 years she was a size 5. Suddenly it changed and she thinks it's her metabolism.
yeah, what I said is the following, that if you don't exercise and you're 50 years of age, man or woman or more, you lose lean muscle mass, you lose your muscle fibers. Your basal metabolic rate increases, your basal metabolic rate, decreases, which means that when I'm at rest, how many calories do I burn? The more muscle mass I have, the more calories I'm burning. So you ladies who are menopausal must exercise 7 days a week, an hour of brisk walking and 20 to 30 minutes, 3 times a week, never on consecutive days with light weights or bands. And you'll see that you'll not gain any weight. And watch, if you're Italian, cut back on your carbohydrates, your sugars, and your salt intake.
What about wine?
Well, probably a glass of wine is okay to drink every day if it's not contraindicated for any medical condition that you have. 1 glass of wine for women, 2 glasses of wine for men.
That's not fair.
I know it's not fair.
What about if you're 82 years
And
old?
it should be a regular sized glass, because I'll tell an anecdotal study. My grandfather, rest in peace, had diabetes, and he used to drink a bottle of wine a day. And he went to his doctor and he said, "Mr. Bonura, only have 1 glass." And he bought a glass this big that held a whole bottle of wine. And he commented to me and my father and mother, what a wonderful doctor he was going to.
What if you're 82 years old and exercise? Do you still recommend an
Any other
hour a
questions?
day?
If you're 82 years old and you exercise,
If you what?
82 years old and you exercise,
Is I still at 1 hour every day?
still 1 hour a day for an
I
82-year-old?
recommend everyone goes for a brisk walk if you can, 1 hour, 7 days a week.
Even at 82? Okay.
Even at 82, Dr. B?
Even at 92.
Even at 92.
Okay, thank you.
Any other questions?
That's it.
Can you still hear me?
I can hear you.
I just want to say thank you. I thought this was excellent. It's motivating.
Good, I'm so glad. Thank you all for joining us, and the recording of this will be posted on Dr. Bonura's website. So if you missed anything or you want to share it with a friend, we'll have it posted on the website
Oh,
shortly.
thank you.
It'll also be posted on my Facebook page. You enjoy. Have a nice lunch.
Thank you.
No
Ladies
Haagen-Dazs.
and gentlemen.
Thank you, doctor.